Spleen 1 is the medial nail point of the big toe. Be sure to locate this point off of the nail bed. Try and tuck it in to the flare of the base of the distal phalange. Spleen 2 is located in a depression which is distal and inferior to the first metatarsophalangeal joint. See the knuckle of the big toe, come distal and inferior and tuck your point into the flesh at the flare of the base of the proximal phalange. Spleen 3 is located in a depression which is proximal and inferior to the first metatarsophalangeal joint. Find the knuckle of the big toe and fall into a nice depression which is proximal and inferior to it. Be careful not to approach this point from this direction, or you may try and find it on the wrong side of muscle. This point lies between bone and muscle. Spleen 4 is located in a depression which is distal and inferior to the flare of the base of the first metatarsal. Feel along the inferior border of the first metatarsal, find the flare of the base and place your point in between that flare and muscle. Spleen 4 is about 1 cm proximal to spleen 3. Be careful when palpating along the inferior border of the metatarsal that you don't overshoot the head and find this nice dip in between the medial cuneiform bone and the base of the metatarsal. It's a nice dip, but it's not spleen 4. Spleen 5 is located in a depression which is anterior and inferior to the medial malleolus. Trace along the anterior border of the malleolus and the inferior border and then palpate whilst you articulate the foot. Feel for a nice dip. Spleen 5 is in that dip. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Spleen 7 is located 6 cm superior to the prominence of the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. If you're having difficulty identifying the medial crest of the tibia, just raise the leg slightly and the flesh will fall away from the bone. Remember, it's half of your patient's finger breadth, not your own. Spleen 8 is located 10 cm superior to the prominence of the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. If you're having problems locating the medial crest of the tibia, just raise the foot slightly and this should enable you to palpate it. Don't press too hard. This point can be quite tender on women. The easiest way to find spleen 9 is to palpate gently up the medial crest of the tibia until you fall into a nice depression formed by the medial crest of the tibia and the inferior border of the tibial condyle. This point's in a depression. It's not on bone, it's not on muscle. It's in a tender depression. Spleen 10 is located 2 cm superior to the superior border of the patella in a tender depression on the height of the muscle vastus medialis. We know the patella is 2 cm long, so we can use this to calculate how high up the leg this point should be. A common mistake is to mark this point too far anterior or medial. A good location tip is to have the person press their leg down into the bed, which will bring vastus medialis into relief, and you should be able to palpate the depression in the height of it that forms spleen 10. Spleen 11 is located on a line joining spleen 10 and spleen 12. It's half the distance between the inferior border of the patella and spleen 12.
Spleen 12 is on the lower abdomen, level with Ren 2, 3.5 cm lateral to the midline, lateral to the femoral artery. Spleen 13 is on the lower abdomen, just below Ren 3, 4 cm lateral to the midline. Spleen 14 is just superior to Ren 6, 4 cm lateral to the midline. Spleen 15 is 4 cm lateral to the centre of the umbilicus. Spleen 16 is 4 cm lateral to the midline, level with Ren 11, 3 cm superior to the centre of the umbilicus. Spleen 17 is in the 5th intercostal space, 6 cm lateral to the midline. To find the 6 cm, find the midline, the lateral extremity of the acromion, which is 8 cm, and divide that down to find your 6 cm, and pop your point in the 5th intercostal space at the root of the breast. Spleen 18 is in the 4th intercostal space, 6 cm lateral to the midline. Spleen 19 is in the 3rd intercostal space, 6 cm lateral to the midline. Spleen 20 is in the 2nd intercostal space, 6 cm lateral to the midline. Spleen 21 is in the 7th intercostal space on the mid-axillary line. Palpate along the 7th intercostal space until you get to a point on the mid-axillary line level with heart 1.